All right, so we've got folks continuing to join, but we'll go ahead and get going and do some of the introductions and housekeeping. Welcome, everyone. And thank you for joining us for today's webinar on advancing trauma-informed practices in housing, where we're going to be digging in with a bunch of practitioners and talking about lessons from the field. A couple of housekeeping items. Number one question, this session is being recorded, and the recording and the slides will be made available following today's session. The structure for today is going to include some more traditional and formal presentations, but there will be time at the end for a Q&A. Please feel free to use the chat and the Q&A functions to ask questions, and also to share your own experience and reflection as you're hearing from colleagues and practitioners sharing their experience. We want it to be interactive and want to hear what's useful and what you're all learning and what you're working on as well. I'm Alexandra Nassau-Brownstone. I'm Vice President of Resident Outcomes and Cores at Stewards of Affordable Housing for the Future, otherwise known as SAFE. And so I want to introduce our guests who are joining me today. Juliana Stewart is Vice President of Community Impact for Preservation of Affordable Housing for the Future, POA. Stephanie Bass is Assistant Director of Resident Services at AHC. And Roxana Hernandez is Assistant Director of Community Engagement at AHC. I'm really thrilled that we are going to have these three leaders who are going to be talking about how each of their organizations has been moving to advance and operationalize the commitment to be more person-centered and trauma-informed over the last couple of years. POA recently wrapped up a robust series of pilots where they've been implementing different trauma-informed practices, and now they're really moving towards scaling those initiatives and thinking about how they take those lessons and move them forward. And AHC is a few years further along in this work, but still very much engaged in actively building internal capacity. And so it's going to be, I hope, a good conversation and sharing around where each of these organizations are in that process. So they will reflect on that organizational journey, share some of the learnings, and continue to have a conversation about how they reframe and reimagine how we approach this work. Some of you may be new to CORES. CORES, Certified Organization for Resident Engagement and Services. It's a certification that was launched in 2018 that recognizes owner-operators and third-party providers that have developed a robust commitment, capacity, and competency in providing resident services coordination in affordable rental homes. And CORES is operated by SAFE and is rooted in SAFE's work to advance practical policy solutions that create and preserve healthy, sustainable, affordable housing, and leverage home as a platform for supporting resident stability and well-being. SAFE's resident outcomes work is really comprised of three broad strategies. The first of which has been to better articulate and establish a shared understanding of what quality, resident-centered, and data-driven resident services coordination is. The CORES certification and the framework for a system of service coordination that CORES is built on articulates many of these shared best practices. Another core component of the work that we've been doing is focused on creating a common framework for measuring impact and to demonstrate and build the evidence base that demonstrates the impact of service-enriched housing. And a third core way we approach this work is really focusing on going upstream to identify what's needed for a healthy environment and improved outcomes. How do you apply that broader social determinant health framing for our work? And a major component of this has been focused on identifying and understanding the opportunities for affordable housing providers and resident services practitioners where they have the opportunity to mitigate trauma and toxic stress, both for the residents that they're serving and for the staff that are doing this work. So SAFE really focused very intentionally on this work starting in 2018, engaging with our members and others in the field to consider how do we build infrastructure and support for frontline staff? How does the built environment and the policies that we implement in our communities, how can those be used to mitigate trauma and toxic stress? We started to think about how do we identify and understand opportunities to operationalize resident-centered commitments that prioritize voice and agency and power sharing with residents and with staff. And last year, we published a toolkit, Measuring Agency and Voice, which identified 4 domains of resident agency: resident satisfaction, social cohesion, resident power, and civic engagement. And so over the last couple of years, we've continued in this work, and we've been a partner with POA on their Trauma Resiliency Initiative, which you're going to hear more about today. We wanted to highlight that there are quite a few resources that can be found on SAFE's website and on the Corps' resource library. But I'm really excited to hear from my colleagues on today's call, so I'm going to pass things over to Juliana Stewart, who's going to set the table, so to speak, and give us some grounding and context for trauma-informed housing.
Awesome. Thanks, Alexandra. And I just want to start by thanking SAFE and Corps for hosting this conversation, and all 150 something of you for being here. I see we have a lot of resident services coordinators, managers, supporters, so you are among friends, and we're really excited you're here, and we hope you'll engage in the chat for this presentation. So just a little bit about POA. We are next slide, Alexandra. We're a national nonprofit. Our mission is to preserve, create, sustain affordable, healthy homes that support economic security, racial equity, and access to opportunity for all. And in 2020, just a little bit of context, POA was very fortunate enough to receive a large grant from the Housing Affordability Breakthrough Challenge, which was sponsored by Enterprise and Wells Fargo. And that was because we were increasingly seeing that our housing system had really grown to prioritize risk management and compliance, which are important, but really prioritize that at times over the needs and experiences of people who live and work in our communities. And we really felt like lessons from trauma-informed care could be applied to really reimagine our kind of whole housing system through this lens of resilience and healing, not just rules and regulations. And so our plan from the start was always to share everything we learned in the hopes of kind of continuing to build this larger conversation and policy agenda around trauma-informed practice. So what I'm going to share with you is a couple years worth of learning, but we're still an organization that's in the process of changing and growing. And so we're excited to kind of share where we're at so far and engage with all of you. So on the next slide, just to give you a sense of where we work. We're mostly in the Northeast, Midwest, Mid-Atlantic, and DC. We actually just crossed the 13,000 households threshold recently. So on the next slide, I want to just start by kind of offering some basic definitions. You can go ahead to the next slide, Alexandra. So in this session, we're going to use this language of trauma. We are not going to ask anyone to talk about their own personal experiences, but we do just want to acknowledge and kind of set some shared language around what this is. And what I'm offering to you is this definition that POA residents and staff kind of came to collectively, and I felt like it was most appropriate. And really, it's accessible. And it's this idea that trauma is really deeply personal, and it's a negative experience. It's too much to handle. So I think, many of us know, trauma is pervasive across the US, and if it's left unaddressed, it can really have a lasting impact on any of us, on our body, our brain, and our behavior. And on the next slide is a kind of another insight I want to share in tandem with that definition from Resmaa Menakem, who's a trauma specialist, healer, author, many things. And what I really love that he says is that trauma is not a flaw or weakness, but a highly effective tool of safety and survival. And it's the body's protective response to an event that it perceives as potentially dangerous. And this idea of perception is super important because perception is not universal. And while we may believe that we're doing this work in the housing sector, we're here to offer something that could help, whether that's building a rental home or managing toward HUD compliance or offering a new program or service, it doesn't mean that thing can't be perceived as untrustworthy or potentially threatening. And so what we'll talk about throughout this conversation is directly engaging with the people we seek to serve, whether residents or staff or others, is really essential to understanding what we think will be helpful, will actually be, and won't actually risk doing more harm. And on the next slide, I want to offer this image that we worked on to really ground our understanding of the relationship between trauma and housing. That relationship is multifaceted. And so when we talk about trauma-informed care, I think we tend to focus on number one. We really focus on the individual, on the experiences that happen in our childhood or within the household. And this is really trauma kind of in the most personal, intimate sense. And within the housing system, that might look like housing instability. It might look like displacement or overcrowding. Really super important. And I think where a lot of the conversation around trauma-informed care tends to happen. But we also really want to zoom out and look at the ways that other parts of the housing system can either cause or exacerbate or intersect with other forms of trauma. And so within a property, this could look like unsafe or unsanitary housing conditions, or punitive rules and policies that contribute to harmful interactions with staff who work there. Within the climate, things like, increasingly severe storms or floods, or within the community, community conditions like over policing or gentrification and community change where, outsiders are coming in and longtime residents don't have power or the ability to kind of shift and control some of the changing nature of their neighborhood. These can also be sources of trauma. And lastly, that, this is all really rooted in systemic forms of trauma. It's a legacy of discriminatory housing policy, redlining or restrictive covenants or predatory lending are all just really intentional forms of discrimination that strip wealth and can in many ways perpetuate the housing crisis that we have today. So when we move to the conversation about being trauma informed, I think we're all really trying to kind of root in this understanding that trauma is so deeply personal, but it's also deeply connected to these larger community and social forces. And on the last slide, this is actually borrowed from our friends at AHC to really kind of help drive home why this work is important for housing providers ourselves. We work in this environment that's trauma exposed, and we're all bringing our own experiences to the work. Our partners have really reminded us like this all starts with us and our own self-care and our own awareness. I think we touched on this a little bit, but there's this real inherent power imbalance in this landlord-tenant relationship that's at play here, and that's at play in sort of all those cultural and social factors. This idea that de-escalation and conflict mediation and responding to external pressures, like this is all part of the kind of water that we work in, that we swim in this work. And a lot of this is rooted in historical, intentional, discriminatory practices that, we're all kind of seeing in different ways today and touching in our work. So a lot of this is just about kind of zooming out as we enter this conversation and thinking about, as an organization that's responding, how do we look at all kind of angles of this and think about approaching our work a little bit differently. So with that, I'm gonna turn it over to Stephanie and Roxana.
Thanks so much, Juliana. Good afternoon, everybody. I wanted to start off by also just thanking Alexandra and Safe and Coors for inviting us to be a part of this conversation today. And we'll tell you who we are to start off. I'm Stephanie Bass, and I'm one of the assistant directors at AHC. I support social services teams who are working on site, providing direct social services supports to residents in our Virginia housing portfolio.
Hi, everyone. My name is Roxana Hernandez, and I'm Assistant Director of Community Engagement. And my role here at AHC is really working with the communities and the residents, engaging them, providing opportunities to listen, get feedback, really increasing voice and choice, and implementing all of what we're hearing into the work that we do every day here at AHC.
So Roxana and I are really excited to be a part of this conversation and to share a little bit about where we are at AHC in our implementation of trauma-informed practices. Even though Alexandra said, we might be a couple years into this work, it still feels like we're very much at the beginning. There is always so much to learn from, our colleagues, from best practices, from our residents about, what is working, what is not working. And this is sort of an ever evolving, ever changing process. But it's something that I think we care very, very deeply about. This is such a human initiative. It touches us all in different ways, no matter what our role is. And so thanks for having us. So first, we'll start off by just telling you a little bit about who we are at AHC. We were founded in 1975. And we develop affordable housing and help support communities in the Northern Virginia area, Washington, D.C., and Baltimore, and also Montgomery County. We have 54 properties currently, providing 8,200 homes across the D.C. metro area. We also have on-site resident services programming at many of our properties. And our resident services program started about 30 years ago. And the programming started in response to resident feedback. Essentially, our residents were expressing, we really need something for our kids to do after school. The kids are just bored, So we started a series of after-school programming in Arlington, which is where our property portfolio began, in Arlington, and that's where we have the largest number of properties currently. So we started with after-school programming, and then over the last 30 years have really expanded our programs and services, and we offer many different types of programming for families, children, youth, adults, and our older adults living at our sites. Our programs focus on 4 key areas: so education and youth development, health and wellness, economic mobility and housing stability, and then also community building and engagement. Next slide, please. So I'll talk a little bit about the origin story. How did trauma-informed care, why are we talking about this at AHC? How did this come to be here? And so I'll rewind our timeline back to early stages of the pandemic. I started at AHC exactly 3 years ago on May 18th. So right at the beginning of the COVID crisis. And as we all were doing, our resident services teams were running, very fast to pivot all of our programs and services online, to learn new skills, to support families in new ways. We were providing crisis intervention services in the form of food, PPE, emergency gift cards. So we realized pretty quickly that the COVID crisis was devastating for many of our residents, but it also took a toll on our staff. So we initially provided some basic trauma awareness and response, compassion, fatigue, and self-care training for our frontline teams in 2020. And at that time, I was already connected with the Fairfax County Trauma-Informed Community Network because I've done some trauma implementation work previously before coming to AHC. So we reconnected with that community. And then at the same time, Arlington was also forming its own trauma network called the Arlington Resilience Community. So we connected there as well to make sure that we were collaborating with the broader services community and sharing best practices around trauma work. So that was 2020. Fast forward, a little bit to 2021. Our HR department started a series of DEIB trainings and conversations for staff. And then at that time, we also appointed 2 AHC residents to our board so that we could have their voice in our decision-making process. And then I didn't put this on the slide, but I will mention that at that time, we also, AHC added Roxana's role. So we added a assistant director of community engagement so that we could really have a designated full-time staff person who was, who is working on resident engagement and overseeing some initiatives around getting feedback and support for our residents. And then 2021, we were going through massive change, in addition to the continuing COVID impacts. AHC closed our internal property management company and moved to external third-party property management. across our entire portfolio. So we work with 4 property management partners. That was a massive change, and we're still transitioning essentially from that. 2022, more change. We hired a new CEO who came with a renewed resident-centered focus. We started strategic planning across the organization. And at that point, we sat down with our executive leadership team and talked about trauma and said, how are we going to operationalize this work? What can we do in response to what our residents and our staff are experiencing on many different levels? And at that point, Roxana and I put together a comprehensive training plan for our staff, which we'll share with you in just a moment, because we know that bringing this work into our affordable housing world, we need to create sort of a shared language. So that's why we focused first on staff training and raising awareness for those of us that approach the work from different angles, from different backgrounds. So creating that shared language was a really important place for us to start. And then our most recent piece of this timeline, which we'll also share with you, is we created an overarching organizational change plan around trauma-informed practices. So we will take a look at that in just a second, but next slide, Alexandra. We created this plan with these 6 key principles in mind, according to SAMHSA, the Substance Abuse and Mental Health Services Administration. So many of you probably already have this information if you're looking into trauma-informed practices or you're already doing this work. These are the 6 key principles of a trauma-informed approach. So I just thought it was important to share this, as this is really a grounding information for us when we think about this work. So we always come back to these key principles when we are thinking through how to approach this. So with those in mind, we'll take a look at our overarching plan. I know it's a lot of words, so you don't have to read all of that, but we just wanted to share this plan that really focuses on 4 key areas of change for our organization. Staff training, as I already mentioned, peer support, our policies and procedures, and then our practices and our programs. And so the other way that I've sort of we've structured the information on this plan is through three different phases. So the phases where we have implemented changes already, the changes that are in progress currently and that are going to kind of be ongoing, and then some things that are on the horizon for us, you will see on the bottom part of the plan. So the plan encompasses both small shifts, small changes, such as just being more intentional about incorporating breathing exercises or stretching, into team meetings, acknowledging that everybody's running fast and carrying a lot of stress. So small shifts like that to really big changes, like the creation of a new eviction prevention policy and procedure, which required, hours of work to develop, and then hours of trainings for property management and resident services teams, and much sort of continued oversight and follow-up to make sure we're on track with the implementation. So this plan is really a comprehensive approach. It helps us to kind of just operationalize, put it down on paper, these big ideas and concepts around trauma. Like, we know that trauma impacts people, so what do we do now? So this is our effort to operationalize some of those big ideas. And this will really take years to work through. This is not an overnight change. It's not an overnight shift. It's also a fluid document, so it will likely change over time as we work to keep up with the evolving needs of our residents and our staff. And now Roxana is going to share a little bit more with you all about the staff training plan that we put together, and then more about our resident engagement approach.
Thank you. Next slide, please. All right, so this is our staff training plan that we created. And the first step, again, as mentioned, into implementing this work, especially in this non-traditional settings, is to raise awareness. So we know that the different departments within AHC and our property management partners don't typically have the background or the knowledge of what trauma is and providing social services. So we really wanted to start the conversation about what trauma is. So we started the Trauma 101 awareness and response training with our staff. We will continue to do trainings that include de-escalation training for our frontline staff, culture humility training, a trauma-informed supervisor, mental health first aid, and trauma-informed organizations. And we really tailored these trainings to the different departments and the roles and how much time the different departments have with interacting with residents. So that's how we tailored the different types of trainings. And we're lucky enough to have an expert, a trauma expert here, which really helped push the effort. Stephanie facilitated the Trauma 101 trainings as she has worked on this for a long time. So HC is very lucky to have an expert here. Next slide. As Stephanie mentioned, the Trauma 101 were the first step, and we had over 150 participants, which included property management teams, our AHC leadership team, so our CEO and our VPs all were in these trainings, and of course our frontline staff. And the resources that we provided were trauma-sensitive strategies, so de-escalation techniques for difficult situations, having difficult conversations, taking care of yourselves, and again, linking the importance of trauma in public housing, so that they were able to relate to the work that they're doing every day. On the right here, you'll see some of the quotes. We did a survey, a post-training survey to hear feedback from all of our staff onto what their takeaways and experience during this training was. And a lot of them, were really excited about having these conversations. They were able to connect with each other. They were able to really bring the everything together and sharing techniques and sharing experiences and really starting to connect with each other and having tools and tips on how to work with residents using this trauma lens. Next slide, please. So with our resident engagement, we really are going back to those 6 principles that Stephanie mentioned before, which includes resident empowerment, voice, and choice. And with resident empowerment, we are always seeking ways to find ways to empower residents in our community. We do this through peer support. We recently started a resident ambassador committee, bringing different residents from different communities together to talk about, what they're seeing in their communities, what their concerns are, what's going well. If there are concerns, what can they do to be part of the solution? Really empowering them to help us create systems and help us, bring it back to the community. We also are providing opportunities to enhance leadership skills. We have so many great resident leaders in all of our communities, so we want to continue to empower them and provide different type of training opportunities. We actually attended a Community Leadership Institute. This was the 2nd year that AHC took resident leaders. And it was just a really great experience. They got to meet other resident leaders from the whole country and had to share experiences. They came up with different goals for their specific community on how to make things better or build community. This specific group of residents is from a community that opened a few years ago, so it's a very new community. So they really wanted to do community events to get to know each other so that they can work together. And so at the bottom, you'll see one of the events that came from the Community Leadership Institute. They planned a community cleanup day, and it really brought people together, really empowered them to, take care of their community. We had kids involved. It was really great. And we also started a community conversation with our educational theater company partner, where residents came together and talked about their experiences growing up in Arlington, different things, about race and poverty. And so it really empowered them to talk about their stories with each other. And it was actually turned into a performance to the community. And it was really great just to hear residents talking and relating to each other. Next slide, please. Another part of resident engagement is voice and choice. So as many of you also, we have been doing surveys and focus groups to really gather resident inputs. And the data that we get from these surveys and focus group, we use to tailor property service plans by community to ensure that the programs and the services that resident services are providing are tailored by property, by needs, by desires. And we also are we've been doing a resident experience and satisfaction survey. So also looking at what their experience is or satisfaction with the physical part of the buildings, the common areas, and so on. And we will continue to engage residents. Our next kind of initiative is to engage residents from the beginning of the process of developing housing. And so looking at what type of building design and features they would like to see in their communities, from playgrounds to courtyards and things that residents find very valuable. Next slide. Again, implementing trauma-informed practices is an ever-evolving process, as Stephanie mentioned, and we will continue to do a regular assessment of the plan, see how it's going, what's working, what's not working, and always seeking ways to learn and incorporate best practices from peers like you all here today. Thank you.
Thanks, Stephanie and Roxana. I'm going to turn it back to Juliana. Then hopefully you should be able to advance the slides, but let me know if you need me to do it.
Give it a whirl. This is awesome. Great job, Stephanie and Roxana. So here we go. Okay, so part of what I love about this space is I'm going to talk about how we arrived at this. And when I look at AHC's organizational plan, there's so many of the same elements that we're also implementing, but we've done it in a slightly different sequence. So I'll talk mostly about our process. And then because there's so many great questions coming through the chat, I'll probably cut short some of the examples. I'll show you where you can find them after the call and you'll get the deck. But I think we would love to spend more time having a conversation and answering questions. So when we embarked on this journey, we engaged a fantastic partner called Design Impact to help us kind of design a process that we felt like really embodied trauma-informed practices while we were sort of figuring out how does our organization become more trauma-informed. And we landed on like what we ended up calling co-design, but looks very similar or uses principles of human-centered design or design thinking, which is sort of like simply this linear process here. You go out, you discover like, what is the problem? What does it look like, all sides of it? You come back, you make sense of it, you brainstorm or develop ideas, and then you go prototype, you test them out. So it's sort of like a product development methodology that seems very linear, but actually in practice looks a lot more like this. And so we're still kind of in like the fuzzy phase, even though we've done like a little bit of prototyping. And so I'm going to walk you through each step of our process. We also have a toolkit that I think Mina will drop into the chat. You can find this all there, and you can find like agendas and worksheets and interview guides. So all of the tools we use are there. So where we started was actually forming different teams of residents and frontline staff in different communities in POA's portfolio, and they led the process with support. But it was really important to kind of start from this place of collaboration between residents and frontline staff. Everyone was compensated, everybody got some training. We've made referrals or recommendations for residents to like school programs or job programs as a result of it. But it was really this like lowering the hierarchy or like the power differential and having residents and staff working together on this whole process. And also this was during the pandemic, so most of this actually happened virtually. So what you're seeing here is the first workshops that we were able to bring people together in person. Alexandra, I'm having kind of inconsistent response to the navigation, so we'll see how this goes. You can go ahead and click send. So once we formed a team, we really focused on building community in the team. And I love the examples Roxana gave around using creativity to do that. Here's an example of an exercise we did. We gave everyone a prompt or a question, and then they went out and took a photo that responded to the question and captioned it. And so the question was around sort of like, what makes you feel at peace? What makes you feel joy? And then like, what makes you feel stressed or what makes you feel overwhelmed? And this was one resident's response. And so that just like draws out all this really rich insight and also helps the team kind of get to know each other better. So love those creative exercises. We'll go ahead and hit the next one. And then we realized that there were so many different things we could focus on that we kind of had to clarify, where did we want to start? Where do we want to pay attention? And so, Alexandra, if you click again, we took what we ended up learning from these 4 very different communities and realized there were a lot of really similar themes. And so these were properties in different states. Some were urban, suburban, rural, like large campus style housing, scattered site housing, but a lot of the same themes. And so in our toolkit, we created an assessment that's sort of like, if you're thinking about where to start or how to clarify your focus, some of these reflection questions might help. And on the next slide, once you kind of know what you want to learn, what we did is we went out and did basically community participatory research. So residents and staff worked together to develop an interview guide with language that made sense to them. It wasn't like, hi, what's your trauma and how is POA making it worse? It was more like in a way that they feel comfortable asking their neighbor or talking to their neighbor. It looked a little different at some of the sites, just based on that community. And then they went out and had conversations. Again, anyone who participated in the conversation was compensated. So we used a little bit of funding for gift cards for people for participating. And then, so they basically went out and got like all this data, and then they came back together and said, what does this mean? So not only were they collecting the data, they were also processing it and telling us, this is what this says. So it wasn't like we were just sort of doing a survey and interpreting it also, which is what we typically do. It really was about learning together. And then the best part came when we got to think about how we wanted to respond. And so we used a lot of different creative exercises to brainstorm ideas for how to respond to everything that we heard. So a lot of what's driven our trauma-informed housing plan is what came out of these brainstorming sessions. An example here is like using improv. So if anyone ever read Tina Fey's book, she talks about yes and. You never say no in improv, you just build. So during brainstorming, it was like, there's no, there's just a lot of building. And you just get to these really big, exciting ideas. And there's a lot of like energy and power and empowerment in that process, which was really cool. And then Alexandra, you can click ahead twice. So after we did all this brainstorming, where we landed was going out and doing these really small scale tests of change. So instead of saying, great, we've heard everything, now we know what to do, it was like, we've heard everything, we have really good ideas, but are those ideas actually going to respond to what residents and staff were telling us? And that was what testing and piloting was all about. And so go ahead onto the next slide, Alexandra. So I talked a little bit about clarifying our focus, and I just want to kind of hover on that. So on the next slide, essentially like what we learned from all of this research was these key themes. Some of them I think, are fairly straightforward. It was the pandemic, staff were experiencing a ton of burnout, there was a lot of disconnection, but we also heard like these were things that were happening in our communities before the pandemic. It was just being amplified. I'll just touch on a couple of them. So this idea of encouraging community care was really, really strong and powerful across our portfolios. And I think about it as like historically, resident services in particular, sort of this like hub and spoke model, like a bicycle wheel, where you've got like the services staff in the middle and all the residents on the outside, and services staff are expected to support everyone and to be the person that has the answer. But in reality, the kind of community caring for itself and having and being supported to develop norms for their building and have house rules for just their building, not the whole property, or to be supported in developing and running their own programs, or to provide support to one another, is much more empowering than kind of designing a way where staff, resident services staff, or even property management staff are supposed to have all the answers. So lots of ideas came out around how can we better encourage community care rather than asking and expecting our staff to be all things to all people. I think this idea of redefining leadership was a really big one, both frontline staff and residents, and this is management staff, maintenance staff, felt like they were in a position where they don't typically have power over decisions that impact them. And so how do we think about the tiny ways and the big ways that we're kind of stripping power, even from our staff? And it came down to things like, I have to ask my boss for money to buy stamps. So then it makes it hard to just like do my job. Why can't I go buy the stamps? These like little things. Or residents would say like, you have these light bulbs that I just can't replace on my own. And so I have to wait in line for maintenance to come out just to replace a light bulb. And that feels like frustrating, but also kind of disempowering because it's taking you a long time to come change the light bulb. So if you're not even going to do that, why should I believe that like all these other resident services programs you have are going to be helpful to me? So that was sort of what we kind of pulled out of all that data and learning and said, okay, these are the opportunities for us to respond. And then on the next slide, I think the other really big learning for us was it goes beyond resident services. And it's a lot to ask resident services to carry this work in their organizations. And like Stephanie and Roxana talked about, how do you go upstream in the development process and think about key decisions that get made that have an impact on not only on residents, but also on the management team that has to manage this building and community in the future? And what are the opportunities to influence that? So how can you be trauma informed in the development process and in building design? So if you go into our toolkit, we've got some design guidelines that is both features to design, but also how to get there, how to do community engagement. So you're pulling that inside out. But this also touches policies and procedures, it touches programs and services, and it absolutely touches human capital. It touches the people who work in the organization. And so Roxanne and Stephanie talked about, peer responders, peer support, critical incident response. Like these are all things we're coming at from an HR perspective. How do we think about responding to community crises, knowing that our frontline staff are the ones who have to show up and do a job, who are also experiencing and living through and witnessing that same pain? How do we show up for them and have more kind of support nets for them? So I'm just going to do one really quick example, and then I'd love to open it up for questions. And I actually, Alexandra, this one, it just emphasizes a lot of what Stephanie and Roxana said, which is great. Advisory boards, leadership opportunities, lots of good examples there. Let's go to staff well-being, because I want to just point out a place where we got it wrong. So what's really helpful about this kind of co-design approach is that you are, even when you're going to implement your idea or you want to respond to everything that you learned, your ideas are still kind of resting on assumptions. Like we assume that the thing we think is good is going to be good. So you have to go out and test the assumption to know if you're on the right track. And so our staff were feeling really burnt out and overwhelmed. And one of the team said, we need to do wellness at work. We need to bring self-care to the job because people are not taking time for themselves during the workday. So this was staff's idea for responding to something they heard from their peers. So they did a wellness day. It was all about self-care, and it was great, and people really liked it. And then we did a follow-up survey, and people said, this was nice, but that's not actually what's like causing me frustration on the job. The issue is that I'm not feeling supported by my supervisor. I'm not feeling heard by leadership. I don't feel like I have a team here to help me. And so even though the idea was really nice and it came from their peers, the learning was that's not actually addressing the root cause. So how do we think about that differently? And I think that was a big learning for our staff too. Like, oh, wow, I thought this would be as simple as bringing a masseuse to the property to like give massages and manicure, but unfortunately no. And so like as a next step, we said, okay, what's like the next test that we could do? So on the next slide, we ended up instead like running this game to incentivize more regular FaceTime between supervisors and their staff to just kind of figure out like, where do people go when they're incentivized to have that and what comes out of it? And we did some before and after testing and said, if we could make it easier for people to have FaceTime with their supervisor, might that kind of lead to some of the stuff that we're looking for. So it just, again, emphasize like the idea of like testing things out can be a really helpful way to do the work and not dive right into something that might not end up actually being what residents or staff want or need. So I'm just going to jump ahead, Alexandra, to the learn more about the toolkit slide. A lot of this stuff is online and we would love for you to go check it out and give us feedback. So we created this toolkit and it touches on not just resident services, but also what we learned about design, what we're learning about policies. I saw some questions in the chat about training. We've sort of done a little bit of both. We've like co-developed training with some outside consultants that we felt like really focused on our staff's needs in the housing context. And then we're also looking at referring staff out to other trainings or bringing other trainers in. So you can see a little bit about how we're doing training and download all sorts of resources directly from there. So I'll wrap it there.
Thanks, Juliana. So we got a lot of good questions in the chat. So I'm just going to go right there and following up on something that Juliana was just talking about. I want to pass it back to Stephanie and Roxana. There are a couple of questions that came in specifically around staff training. I mean, I think everyone recognizes the need. Folks sometimes have that internal bandwidth. They're looking for external partners. Can you talk a little bit about how, which pieces you did in-house, who you partnered with, how you think about that?
Absolutely. Yeah. Great questions. So I mentioned early in our timeline that we reconnected with our Fairfax County, our local trauma-informed community networks. So if you are looking to implement this work, I would say definitely seek out your local, if you have a trauma-informed community network, TICN for short, if you have one that is in your community or maybe not too far that you can sort of plug into, they have been an invaluable resource to us in terms of the training piece, because Fairfax County's network is very well developed and already had a lot of these trainings that they offer. So the cost of care, the compassion fatigue training, we're going to partner with them to do. We've already partnered with them to do that. They're going to be coming to do our trauma-informed supervisor training. The 101 training that Roxana talked about that we've already implemented, they had a basic 101 training that we partnered with them. We used that and then tweaked it for the affordable housing space. So really, I can't say it enough. I can't promote trauma-informed community networks enough, because there's so much depth of knowledge and wealth of information that can come from those established groups that are already doing this work in different spaces. So it's a wonderful resource. They have been really, really helpful. And then we're, contracting with outside trainers to do more specific trainings like cultural humility, that type of thing.
There's another question specifically around, so AHC transitioned from in-house property management to third parties, and you're working with a number of different third parties, which we know can present some challenges. How are you thinking about and approaching rolling out this initiative, getting buy-in? What have you learned in that process, or that you would sort of highlight as being really important to doing this?
Yeah, absolutely. Definitely a lot of lessons learned. And we're still learning lessons that we're still learning, but that the trauma awareness was part of the conversations from the beginning with our third-party property management partners. So we set out the expectation, and the hope that they would participate with us in those trainings, and they did. We trained almost everyone, so property management staff in the office, but also maintenance teams. Some of the maintenance teams were so wonderful and just so appreciative of like being in the room and, expressing their experiences that they've had on site that have been really, really difficult. And, just being a part of that was, I think, meant something to them. So
I think too, like during the trainings, we, as Stephanie mentioned, we really focus on the human initiative, so that, you know, we're providing tools for both property management teams to take care of themselves and also have resources to take care of our residents. So it's really a whole human experience and support that was given. As Stephanie mentioned, when we first, you know, began transitioning to our third-party property management, we also created a sort of agreement that included the trauma trainings in there and other types of trainings that we want to ensure that the property management teams are doing. There's a lot of collaboration, even creating the eviction prevention policy. I can't remember how many hours we sat with leadership on both our teams and our property management teams, going line by line, looking at the policies, you know, getting all the different perspectives, but making sure that at the end of the policy was really resident centered and really aiming at not re-traumatizing residents and, you know, evicting people. So it's definitely a lot, and a lot of collaboration and a lot of conversations, and, you know, talking about the why this is important and reaching that shared understanding.
Thank you. We've had a couple of other questions that I think I'd love to hear from all the panelists. I think each of you touched on it a little bit already in some of your comments, but what have you found to be sort of the most effective ways of identifying resident leaders as a part of this work? You know, this can be hard. Some, you know, HC, you're more sort of geographically concentrated in the Mid-Atlantic POA. You all have a larger geographic footprint. How do you each think about identifying and engaging with resident leaders as part of this work? Maybe I'll pass it to you first, Juliana.
Yeah, that's a great question. And I just want to affirm all the questions that are coming in about how to work with management. I think there's a lot of ongoing cultivation that you have to do there. We have in-house property management, but we in many ways have many of the same challenges. So that, you know, there's certainly no like one right way or the other way. So one of our challenges is that we are, like Alexandra said, we're not in one geography. So it makes it a little bit harder to be present everywhere. So we've been thinking about like different tiers of leadership opportunities. And so, for example, we have a national resident advisory board, and we weren't sure if that was going to really work, if residents were going to feel like empowered working with others outside of their community. And so we went to our senior staff and spoke very frankly with them and said, listen, like, this is what we're doing here. And so when you talk about this with residents you have in mind, be very clear up front, like where the power and influence is. This is like, they can tell us what they want us to do at a really high level, but also like, if there's something that's happening in their particular community, we're going to work with you to get it done. So like setting really clear expectations, I think was super important. And then we did like a whole interview process. It was very low stakes, but we did an interview process, and we went back to them a year later and said, we're going to recruit new people to join. Do you think we should do this? And they said, absolutely. Because when we're signing up for this, we also want to know, like, what is the expectation going to be like? What can I expect of you? What do you expect of me? So taking that time, I think, was really, really important. The other thing that is not necessarily about recruitment, but super, super important that we learned is like, just really paying attention to facilitation. No matter what, people will do what they need to do to get their needs met. So even though we say this isn't this place, you know, this isn't the best place to talk about changing an issue inside your unit, whatever's happening inside your unit matters to you. So we need to know how to handle that with grace and respond and follow up, and then also know how to kind of facilitate the space to get the conversation and include others in it as well.
Stephanie and Roxana, anything else you'd add?
Yeah, I definitely agree with Juliana that there's different ways to engage resident leaders. As I mentioned, the CLI was more property specific, and we do have a lot of events and resident-led activities that are property specific based off what, you know, residents are seeing, or what their goal is, because different communities have different goals for their specific community. And so we have that tier, and then we also have kind of that resident ambassador committee where we have residents coming from multiple properties, but this really helps us identify themes and helps us create structures and helps us incorporate that feedback into policy that will affect a multiple number of communities. And so a lot of what we do there is, we have the residents pick out topics that they want to discuss and really empower them to do that. We also had a referral process. So a lot of our residents have lived in our communities maybe 20 plus years. And so we really looked at residents that were invested in the community, that had really good relationships with both resident services and property management teams. We also looked back to the committee and asked them, who else should be here? Who are we missing that is here? So kind of that word of mouth, identifying leaders within themselves. So definitely different opportunities, different ways to engage leaders.
We have just a couple minutes left. So there are a couple of questions that I saw coming in around how you understand success and growth and measurement and accountability in this space. This is long-term work. This is messy work and complex and across your organizations, across different departments. So how are you, as organizations, as teams, trying to identify data points, measures, or sort of movement in this work? How do you track that?
Well, I'll just say, I'll start and say, I think it's sort of like the ongoing, that's the ongoing work of this, is how are we measuring impact? Not easy to do. It's not as tangible as other, markers of success. So we are seeking funding to do some trauma-informed spaces, transformational work. And as part of that, we would definitely survey our residents beforehand, and ask how they're feeling in the spaces, and then survey afterwards to sort of to have some data around how impactful those changes were. Also including them in the design process, as we mentioned, to hear, how to incorporate different aspects that they would want to see in their communities. And then in terms of movement, something that I've observed over the last few years is other divisions are taking the lead on some of these changes. So our construction manager is inviting me to the meeting with architects to bring in the trauma lens in, picking out what colors are we using? Are they do they fit with the trauma-informed design, guidelines? Are we using cool colors, not, aggravating colors? So all of those aspects that those people are sort of taking the lead in making sure we're doing that. Our development team is saying, how do we incorporate this into our RFPs from the very beginning, using these principles to inform the work that we plan to do. So it's an ever-evolving process, but that's how I kind of see movement, is it's not just the services people, driving this.
Yeah, I would totally agree. That's a really great way to think about seeing signs of change. I think, our theory is that this strengthens things we already care about, and that we do also, actually, Alexandra, since you still have the slides up, if you could go back one slide, we should over time start to see changes in like the things that drive the housing system still, right? Like property performance, or like in resident success. I think we know that resident-centered models produce better outcomes for individuals and families, but also bringing in a new way of thinking about change. And so our partners helped us think about mindsets, actions, and conditions as a way to measure change. And so our teams of residents and staff came up, this is a sample of what they came up with, but like they defined for us, this is what it would, how I would think, this is what it would feel like, this is what it would look like for things to feel like they're changing. And it's not usually how we talk about the landlord-tenant relationship, right? We see value and strength beyond transaction of money and services. The landlord relationship is based on the transaction of money and services. And so we created a couple surveys as well. So if you're looking to supplement your existing measurement with surveys that measure belonging or sense of agency, or the kinds of interactions that lead to these changes in actions and conditions, those are available on our toolkit as well. So I think it's this balance of like staying committed and looking at the things that you already measure that matter to you, getting stronger. And SAFE has done so much good work to define that, and the CORS resource website has that. And then also, like, how else will we know that we're changing the social conditions where people live and work, and that we're on the right track, and our residents and staff a part of defining those?
Well, thanks to all of you, to Juliana, Stephanie, and Roxana. We are at time. As Juliana said, there's in the toolkit that POA just put out, there's a huge number of resources. Some of those examples, there are additional resources of survey tools on the CORS resource library. As I mentioned at the beginning, SAFE had put out this measuring resident voice and agency tool that asks both sort of organizational level assessment questions and has some ideas about how you might measure some of these things across those 4 domains of agency and voice around satisfaction and civic engagement, et cetera. So with that, these are all the places you can follow up and engage with us. We thank you for spending the last hour with us, and please reach out with other questions, stay in touch, and we will be sending out slides and recordings soon. Thank you all and have a great afternoon.